So let's talk about the PRP, the platelet-rich plasma. Maybe you're gonna propose it in your office, and it's very common and the most frequently prescribed and done on our patients. So I'm gonna try to explain the scientific principle and most of all, try to criticize the principle, because you could be a robber if you don't give the right information to your patient, because you will see it doesn't work at every time. So it's really important to be honest with your patient, and I'm going to try to prove it with the science. I would like to give you some culture about the history of PRP. So it's very ancient. It began on 1960. The first transfusion of platelet concentrates. After the Dr. Ferrari used it in cardiac surgery, and the really starting point for wider use of PRP is in maxillofacial surgery, in my specialty. So it's a wonderful specialty, which I done every day of my life. So we use it for regenerative bone properties. So since then, PRP has been used for our specialty, maxillofacial surgery, but most of all in periodontal surgery, like pre-implant bone grafting, and it proved its efficacy. It's proved by the science. After, we can use it in cosmetic surgery, especially for the hair regeneration. But we can use it for the scar, skin rejuvenation, and fat graft survival, hematology, rheumatology, and the orthopedic surgeon really use it for the fixing of the joint. After, you can use it in dermatology. So it's very common, very used in private practice and now in university practice, especially for surgeon specialty like maxillofacial surgery and orthopedic surgery. The pathogenesis of androgenetic alopecia is not completely understood at this time. But PRP seems to have a possible capacity of decrease the AGA. So it is known to involve a hair follicle miniaturization process in which terminal hair is transformed into thinner, softer vellus-like hair. So it's the definition of androgenetic alopecia. So this process is related to the dysregulation of the WNT beta-catenin signaling pathway. And you will see just after this signaling pathway is very important, because you will understand the action of DHT on this pathway. And after, the role of fixing by the PRP. This dysregulation caused premature termination of the anagen growth phase in hair follicles. So you will see with the sham just after. Inspired me with this wonderful article. If you want, you can take a photo. It's a free article on the internet, so you can read it just after the course. It's really easy to read, but it's really specialized with complicated explanation, but easy to read and easy to understand. You just have to be patient and very calm when you will read it. So it's the sham which are coming from this wonderful article. So you will see on the left of the picture, on the left of the diapo, the classical cycle of the hair. You could notice the WNT beta-catenin effect on the dermal papilla, and it's maintain the hair in anagen phase. Just after, if you want to understand more the pathway and its crosswalk with androgen, it's the second picture on the right. So the normal pathway, the signaling pathway on the CHEM A, you can see when the inactive beta